Dr. Jim Orvick from the Oregon Pet Clinic is here to take your calls at 270-9933. Happy spring,
yeah,
I guess.
Yeah, right. I hope it doesn't freeze tonight.
Yeah, a lot of people
Soybeans.
feel the same way. Let's get to the calls. We will start with Crystal in Marshall. Hi, Crystal.
Hi.
Hi, what's your question?
I have a cat. He's 3 years old now. I got him when he was 5 weeks old, and he got an upper respiratory infection. And ever since then, he's had runny eyes and almost like he has an asthma attack, like every once in a while.
Not unusual in cats. Do you have him vaccinated for the respiratory diseases?
I did have him vaccinated. I haven't gotten it done recently.
Yeah, well, the respiratory part of the distemper vaccine doesn't last very long, so you need to booster that every year. The distemper part, one dose are good for life pretty much, but those respiratory things are like us with colds. They keep coming back, and there's several different viruses involved, and some of them can be very chronic. There's one of them is a herpes virus, rhinotracheitis, and a couple other viruses that kind of run their courses. But if it hangs on too long, vaccinating might help. And then there are treatments for those respiratory viruses, some too.
So if it lingers on, help, but
yeah.
Keep up to date with the shots.
Well, yes. You know, lately they've been saying, oh, don't give distemper every year. But that part of the cat vaccine, I think it is important to give every year.
All right, I'll go to Deborah now in Fort Atkinson. Hi, Deborah.
Hi, I have a 2-year-old black lab who's been having seizures since he wasn't even a year old. And I was wondering if you could tell me what causes seizures.
Lots of different possibilities. The most common is inherited tendency. It's genetic or maybe some brain damage at birth or something like that. But when they start that young, it's probably an inherited condition and usually pretty controllable with medication.
But it can be controlled. Most
of the time. My daughter has a little dog that doesn't control very well, but she has seizures, you know, 2 or 3 times a month, and she gets over them.
All right, let's go to Michelle in Beloit. Hi, Michelle. What's your question?
Hi. I have a 10-year-old Pomeranian who has become very finicky with his food. We've tried almost every type of hard food and soft foods that we can imagine. The only thing we haven't went to yet is the refrigerated foods. And we're just trying to get him to eat something, and he's not.
The first question is, has he lost weight?
No, he hasn't.
Well, if he's not losing weight, then I would coax him to eat, right? But if he's losing weight, there's something wrong. He needs to be seen.
That can get very frustrating, though.
Coaxing dogs to eat, but if they aren't losing weight and are active and feeling good otherwise, I don't worry about how much they eat, or, you know, if they take 1 piece a day, that's probably all they need at that age.
And watch out with the treats. They might be filling up on treats.
That's right. It could be something else entirely.
All right.
Okay.
We're out of time. If you're on the line, stay there. Dr. Orvick will talk to you off the air. Thanks for coming in. We'll see you in a month.
Thank you.
And we'll be right back with a final check of your forecast.